Okay. Hello, everyone. Sydney here from Hyro, and I'm thrilled to be your session host. Feel free to type your questions in the chat, which I'll be moderating. Thanks for joining us for AI Governance and Policy Frameworks for Digital Healthcare, led by Buddy Hickman, Chief Digital and Information Officer at Roswell Park Comprehensive Cancer Center. Buddy, the mic is yours.
Sydney, thanks so much, and thanks to all of our friends at Hyro for inviting us to join you today for this all-important event. Our conversation today is going to be about AI, and we're going to bear in a bit around AI governance and such. But before we get started, let me ask our panelists, three people whom I have great admiration for, to introduce themselves by name, role, the organization they're serving, and maybe a little bit about what they do every day. Laura, you want to start, boys?
Yes, good afternoon. Joining from Salt Lake City, Utah, I am Laura Marquez. I'm the Senior Director for Digital Transformation at the University of Utah Health, which is an AMC located in the Intermountain West. And I am really responsible for our digital roadmap and accountable for executing and keeping up to pace with all the digital innovations. So I'm thrilled to be here. This is a rollerblading accident gone wrong, so let's leave it to the children to be on the skate rink. Thanks, buddy.
We're sorry to hear that, and we're also glad that it wasn't rogue AI that led to this situation.
Right.
John, you wanna introduce yourself, John Kravitz?
Yes, thank you, buddy. So my name is John Kravitz. My current role is Vice President and Global Head of Healthcare for Workday. Prior to that, I've been with Workday about 2 years. Prior to that, I was a healthcare CIO and a member of the Chime Board of Directors. So my latest stop as a CIO prior to joining Workday was at Geisinger Health System, where I served in the role for 13 years. And so really excited to be here today. It's a great opportunity to talk about all the advancements that we're seeing in generative AI and look forward to the discussion.
That's wonderful. Thanks, John. Thanks very much. And Martin, you please.
Thanks so much. Hi, so Martin Stanley. I am an AI and cybersecurity researcher at NIST, and primarily my main focus of work right now is AI risk management framework, which is the framework that NIST released to manage risks to people and planet, voluntary, flexible, adaptable framework to assist organizations in managing the benefit risk determination for bringing artificial intelligence into your organizations and into your missions. And I think there's probably no clearer place where benefit risk determinations have to be carefully understood than in this particular sector. So it's very great to be here, and I'm glad to have the conversation.
Thanks, all three of you. I'm George Hickman, buddy to most of you, as I've come to know all of you as friends along the way. I'm the Chief Digital and Information Officer here at Roswell Park Comprehensive Cancer Center, a freestanding cancer institute with a very, very rich history, and just quite a remarkable place to work. I've been here since January. I've served as a CIO in our industry for, I think, 24 years sitting in the role, and along the way spent 13, 14 years in consulting as a partner at EY, worked at PwC, and also a strategy officer with First Health Advisory, cybersecurity firm. Just to mention it for color, I'm just absolutely delighted to share time with the three of you. Laura, we met in Utah at a Chime CIO boot camp. John, I can't even remember the first time we met, but the most impactful time I had with you, you were sitting and having dinner at a really nice place in Napa Valley with our wives. And then Martin, we met through a mutual colleague, Victoria Piliteri, who manages the cybersecurity risk management framework. Shared a podium with her back in February at Vive. And when we were done, we were chatting. She goes, "Is there anything I can do for you?" And I said, "Yeah, would you introduce me to Martin Stanley? I'm trying to write an AI policy and I need help." So we've had more than one conversation. In fact, Martin's even spoken to our organization at one of our AI town halls as we've started to work here. So I'm grateful to have all three of you in my life. Let's kick off the session with a question for John and Laura. Are there any really interesting use cases that you're working on, having development within your own organization, something you'd just like to talk about for a minute to spark some conversation around what's really happening out there in the health sector?
Laura, would you like to go first?
Sure. Thank you for the opportunity. Yeah, I'm really right now excited about some of the work that we're doing in various cloud environments. We are trying to have a multi-prong approach with various vendors so that we could really explore and maximize the technology. One use case is with our virtual care team, where we are allowing them to really help query the data to have better actionable insights. So while our EHR data is great, the trouble with some of the visualization tools are they're just not that intuitive for our caregivers, for those operational leaders. So putting, a chat bot and natural language processing understanding in front of some of those data sets has been really helpful. And then another one that we're exploring right now is for our call centers, thinking about the knowledge base that those agents in a centralized call center must have to know and tap into, having a more readily available AI tool that they can engage with. And then, of course, our clinicians are, eating up the ambient listening technology for rapid documentation. That's been a great win for our organization in also trying to pilot multiple vendors in that.
Yeah, and thank you, Laura. I've got a couple that we've been working on at Workday. It's just a small sampling of the generative AI tools that we have available to us, and we've got these embedded right into our product offering. If you turn on the feature set for using AI, you'll have access to this information. So one of the first are pretty simple, but it's really around the ability to recruit and retain employees, and it's really based upon the skills matrix. So skills seems to be the new way to be able to attract people quickly, identify people who have got the appropriate education and skill set to do the role that you're looking to fill. So we've got suggested skills for workers is one of our main areas of focus for artificial intelligence. And it uses machine learning in order to infer the skills that a worker has based upon, the work they're doing, their resume, a whole bunch of other factors that come into play. But it cherry picks those skills out for the employee, and it actually provides a lot of information back to the existing manager for the employee for opportunities for advancement. Or when you're looking to recruit someone into an organization, this has been very, very beneficial for us. So that was one of the areas within our human capital management part of the offering. And the other is in our finance and supply chain. And that's really about anomaly detection. So when you have journal entries going into the system, it looks back at the last 12 months to see the types of journal entries that the organization has been using and making within their environment. And if it spots something that's an anomaly situation where maybe it's a rogue entry or someone's done something that could be considered inappropriate, it would flag it immediately, serve it up to the financial leadership so they could take appropriate action. This is so much more beneficial instead of trying to clear things up either on a month-end normal close or worse yet on an external audit where things can get triggered and found. So we find those to be, pardon me, very helpful for our finance people, and we've had really great response from people in using those tools at this point in time.
Thanks to both of you for those thoughts. We have people out there that believe, AI is the most significant thing that we could be doing with tech right now, and that the promise of it is over the top. We have others who say that we're going to be headed into, I think, a third AI winter. We've got folks who believe the promise is going to bring all sorts of efficiencies, innovation, and so on. We've got others that believe AI is at times unsafe, may be of concern in terms of demonstrating bias that we don't want, and a host of other factors. Where are your two organizations with regards to those kind of conversations? And what are you thinking back home?
Well, go ahead. You want to start, Laura? I don't mean to step on you.
No, please go ahead, John.
So I think Workday is all in on AI for betterment of the workforce. We've been at this for about 11 years and using generative AI over the last several years really intensely. We were born in the cloud, so it's one of those environments where you get a lot of technology people working together, and they've done a lot of machine learning over the years, obviously, and then looking at taking it to the next level with generative AI. But the idea behind Workday, as far as using artificial intelligence, it's to serve information up for a human to make the right decisions, right? To provide information to them so they can make decisions quickly, accurately, and really save themselves a lot of time and effort. And we're hoping that in the long run, it will save organizations resources and costs because information's available quite readily. And it's been proven. It's something that's it's really been tested and governed very effectively, and it's been proven that it's trustworthy AI, and those are the types of tools that organizations, I think, are looking for going forward. And I think they're looking for vendors that can do that kind of work that they can really count upon, that can be a partner with them. The last thing I would worry about when I was still a CIO would be to bring in something that might be a rogue application because some, physician or someone else may have wanted that. And I was always very concerned and always digging deep in, under the covers to make sure things were appropriate. And it's just one of those things that, Workday they've got a team of over 500 people that work on AI exclusively, just engineers. So it's really important to them. And I think it's important to our customers as well.
All right.
I think we definitely have a mixed bag of, those leaders and laggards in our organization. We probably round out that bell curve really nicely. I think the sentiment, though, with our automation center of excellence that we've really stood up and the approach that we've had is we really want to try to lead out on this technology. There's so many use cases in healthcare. And matter of fact, our backlog of ideas is continuing to deepen, which is exciting. I really think that we have an opportunity, and to piggyback on what John said, to augment our clinicians and really reduce the burden for our caregivers. So we are thinking about how can not only we do better for our patients, but how can we reduce suffering for our caregivers as well. So we are excited and trying every time our EHR vendor comes out with a new technology, we put our name on the list. So I think we're trying to pioneer, but there's some skepticism, and with the LLMs that are out there, we want to make sure that we are poised to react quickly if we see skew or drift, and really be diligent about thinking about how can we remove any implicit bias. And our governor actually passed a law in the springtime to help promote some of the due diligence in telling patients that AI is being used. So I think it puts us in a different position as well.
I just want to say one thing, buddy, before you go to the next question. I applaud Laura and their organization because having worked in healthcare for 30 odd years as a CIO in different organizations, I've seen the burnout, the stress, especially exacerbated after the pandemic. And clinicians, I've seen physicians working 12, 14 hours a day trying to get their documentation complete. And the work that you're doing with Ambient and other tools, it's phenomenal. It will really change their life and hopefully bring more people back into this, into healthcare as providers, because we sorely need them. So thank you for that.
Yeah, thanks.
Yeah, I appreciate that value add, John. Martin, fascinating road you've walked. In a sense, your role now is to help others in some ways cross sector find their center with AI. Why don't you tell us a little bit about the journey? How did you? First of all, how you were working previously in cybersecurity, as I recall. How did you find the crosswalk and into this space around trustworthy AI and AI
Sure.
risk management?
Sure. So, short origin story, I guess, is what the question is. I ran the cybersecurity program at the Food and Drug Administration back from 2009 to 2013. And, during that time, I became very familiar with the healthcare industry in particular, the kinds of determinations that the FDA makes around benefits and the potential harms. It's very clear determinations. And I think when John and Laura were talking, I think both of you did an excellent job of articulating what the benefits could be of bringing AI into your organizations and risks, which is really one of the steps that we go through in the AI risk management framework. So as a cybersecurity professional, I ran the R&D program at CISA, the Cyber and Infrastructure Security Agency, and a lot of the work that we were doing from 2017, 2018 on was in the artificial intelligence realm, and doing cybersecurity and cybersecurity risk management became really clear that we needed some approaches to bring into organizations that were going to be using AI, particularly early on, so they could go through these processes. And I built a relationship with the NIST team that was building out the AI risk management framework, and now they have hired me to come be the spokesman essentially for the framework. And NIST is a non-regulatory agency. I think it's important for folks that are not they're not aware of that, part of the Department of Commerce. And along the way, I wrote a book called Digital Health, which was a benefit risk primer for the use of technology in healthcare with the former CIO at the Food and Drug Administration. So this whole topic is very near and dear to my heart, and something I'm very interested in. I think both of the previous speakers, John and Laura, did an excellent job of framing this benefit risk determination, but once you do that, there's many more things that you have to do. You have to figure out how you're going to be able to measure those, those benefits and risks. Are you seeing the benefits? Is it what you really thought you were going to get? Are you realizing these risks? Are you staying? What is your risk threshold? We don't have answers to all those questions. Now, NIST doesn't set those, but we do create guidance and processes by which organizations can go through and make those determinations where they should be made, within that local community standard, that kind of thing. And of course, how do you go about managing those risks? And, operationally, you need to do it in a risk-based way. Every risk is not managed in the same way. There's obviously a consequence and an impact determination that goes into how closely you're going to manage a particular risk. So, the final point that I will make, which I think is essential to using technology in healthcare, and as John, I think in particular, pointed out, we're not getting away from this. We don't have an opportunity to say we're not going to use this technology. If we're not using it, our patients are going to be using it, or clinicians are going to be using it. People are going to be using it. So there's really not an option to say that it won't be something that we have to contend with, but it needs to be trustworthy. It's a formal concept that's introduced in the AI risk management framework, along with what those characteristics of trustworthiness are, and in particular, things that relate to the healthcare domain. Obviously, valid and reliable. They need to be safe. They need to be secure and resilient. They need to protect privacy. They need to be transparent. They need to be accountable, and they need to be free from harmful bias. And so within this framework, we think of establishing and maintaining trustworthiness amongst the entire life cycle that's involved in using AI, or you could really apply that to any technology, but the framework is focused on AI, and I think that's essential to making patients and clinicians actually want to use the AI products.
I find the framework, especially when you list off the 7 characteristics that you did, to be certainly a great tool to look to. Even the idea of harmonizing on those 7 characteristics, what was that like to get to the point of saying these are the call outs that we should be giving care to?
Well, it really depends on how you're using technology as to which one of those trustworthy characteristics is going to be appropriate or it will be primary. You're balancing, obviously, a benefit risk determination along those 7 dimensions. And the example I always use is image recognition as a particular technology, but used in multiple different contexts of use, which is fundamental. Because AI risk is contextual. The way a technology is used can differ from one use to the next, and that's going to drive your benefit risk determination. So if you are using image recognition and you're doing like autonomous driving, that has a certain set of those trustworthy characteristics that you're concerned with. Some may be more concerning than others. If you are using it for facial recognition for some purpose, again, another set of trustworthy characteristics, and maybe whatever you're using facial recognition for adds additional consideration. And then medical imagery analysis, and again, an entirely different concern and application of those trustworthy characteristics. You're using the same technology to do 3 different things, and that determination of what you're using it for may not always be easy to understand, and maybe the other panelists have some thoughts about that. But one of the things that we do early on in the AI risk management framework is a function called mapping, and within that mapping function, what we're doing is we're identifying that context of use, how the technology is being used, and then specifically what are the risks associated with that particular context of use. And by the way, 3 people sitting in a room are unlikely to be the ones that are going to be able to determine that. You're going to have to bring in people throughout the entire life cycle, patients, maybe third-party, impacted folks to be able to truly understand what the consequences are of bringing AI or even automation into a particular function.
Very deliberate articulation, very good stuff. John, Laura, if you think back home again, what are your organizations doing around the sort of AI governance that Martin's speaking of? I have a little bit of familiarity with what Workday is doing, John, because you opened that door for me to have a conversation.
Yes.
But I'd like to hear more from you, John, and then Laura, you as well. How are you governing AI to assure its trustworthiness in a responsible way?
Yeah, I think number one, we've been in support completely of the NIST framework. In fact, our head of all development, Cheyenne, has been on the NIST task force for a number of years, and so Workday was an early adopter of the NIST framework that Martin's speaking of. It is a very rigorous framework, which we appreciate. The more I dig into it and understand it, I could see the applicability back to my clinician days when I was doing things. And you referenced the imaging studies capabilities because, I implemented facial recognition for patient identification at, registration, intake, and all those points. But then we also did image scanning, for like AAA, anterior aortic aneurysms, for different radiology events. And we utilized those tools for AI too. So, just exactly what you were talking about, Martin, is spot on with that framework. And it's impressive, the level of detail that's gone in and the thought that's gone into this framework. But we continue to work on it. We've been a champion since version 1.0, which has been released just recent. And Workday, we believe the innovation to help unlock human potential is really important. And it's our vision for artificial intelligence. We want to be able to bring more to the employee's role, make it more fulfilling for them. And hopefully make it a slight bit easier to do their job as well, because oftentimes people are getting so entrenched in digging for data so they can make an informed decision, and then hoping that data was governed appropriately and it's clean data to make decisions. We try to bring all that information forward with clean data and keep it factual and timely and relevant for them. So that's really important for us. It's important for identifying opportunities, improving experiences. We just feel it's the right way to go about it for the organization, taking bias out of it. I can tell you from when I've talked to our development team, and I speak to a lot of the people from our AI development team, we have gotten rid of many more algorithms than we've kept because we didn't feel they were unbiased and we didn't feel they were appropriate. And so I think the number that was shared with me was like 2/3 have been tossed that we went through that we thought were great. And we developed a lot of them, and it just wasn't as good as we thought it would be. But the ones that we've retained, and we have about 50 use cases right now, and I'm being told by the end of the calendar year, we'll probably be over 100 use cases with AI. So we're going pretty rapidly. As I mentioned, the team has got some depth and breadth to it, but the framework is paramount to our success, and that's what we follow.
Just one more question to carry with that one, John, before we move back to Laura. So you express that high number of use cases. Is that all intended toward the commercialization in product of Workday? Do you also have other internal AI use cases that are not about Workday product?
Those are specific to the Workday product, the 50 that are available right now. And in the next 3 to 4 months, we'll have another 50. Those are specific to the product and enablement of the product, buddy. So we do use other tools outside of the product for our own people for development and other purposes. But those aren't commercially available. They're there to support us, to support the product development and support the go-to-market strategies and other things that we do.
So Laura, how is governance being done at University of Utah Health?
We are following Gartner's, that Center of Excellence model. So with governance, brokerage, and communities of practice. And, this is, I would definitely say it's a maturity model where we are only about a year into having really have defined what does governance look like. But our ideas that do come in, whether it be internal stakeholders within IT or external stakeholders out in the business and our caregivers, those ideas are collected. And then we're working through a prioritization in our brokerage process. And any ideas that we think have enough, good way that we want to lift it forward, then we bring to our Automation Center of Excellence meetings the governance structure and see them come to life. And we'll actually dedicate resources. We are looking at the use cases that have strategic alignment, where we can really focus on some of those operational goals. And when we start to peel the onion back, we do go through our data governance structure as well that has our robust multidisciplinary membership where compliance and legal and IT and finance, all the folks that we want across the organization will come together. So we are continuing to, sort through our backlog and raise up those initiatives that we think warrant, have great strategic alignment and can give a lot of value back to the organization. On the other side of the house, on the research side of the house, the University of Utah Health has developed a 1U responsible AI initiative, which has also been funded with different private partnerships and through grants. And there's a lot of great momentum. And what we are hoping, especially in my role, I try to act as the bridge between the hospitals and clinics, our caregivers, the problems that we're trying to solve today that we have with those researchers who are brilliant minds. So that's, I kind of call myself like a matchmaker. I try to partner up those PIs with the right people on the technology side so that they're not creating something, in our high computing, on-prem environments. Like maybe it makes sense to be using the cloud for this use case and making sure that they have they're following our data governance process to get that data. If it's an IRB, it's very clean and clear, and so just instilling those practices across, the university. It's been really fun. And I have another use case, buddy, I could share as we go
Jump
on.
right in. Keep going.
Okay, so just actually, it was earlier this week. We had a responsible AI, a big symposium, and one of our maternal fetal medicine doctors came forward and said, I, as a clinician, am having to make really hard decisions on when a pregnant mother should deliver. And as an MFM doc, they are with high risk women, either gestational diabetes, twins, or as the pregnancy goes on, there's just the placenta demise, and so there's a risk to the baby for getting enough nutrients and everything. And so he said, my own brain is like a black box. How can we develop a model so that I don't have to make these really hard decisions of, do I deliver at 36 or 37 weeks, which puts the baby at higher risk? Or do I let the baby go on farther into term, and then the risk of a stillbirth is very high? And for context, stillbirths happen 20 times the rate as SIDS, this sudden infant death syndrome. So it's, these poor OBGYNs are really faced with this critical one chance. They get one chance to deliver this baby at the right time. So now, bringing back to AI, they're looking at right now, our researchers have about 10,000 patients of cohort data that they're using to study and then fine tune the model so that we could reduce that burden on the clinicians from having to make that decision. How can we help them? How can AI take all this enormous information, comorbidities, and so forth, and help aid the clinician to deliver the best patient care? And that's what's exciting. So I share that with you all today because it was really motivating to hear how, I really do think we're just at the tip of the iceberg for where AI is going.
That's a very, very interesting use case, and I wish you well with that one. Laura, just to expand a little bit more, if I'm playing back an interpretation just to test it so you can clarify. So
Sure.
when you reference the Gartner Center of Excellence model, is it that you run a shared leadership governance process around all tech, digital health, and in essence, AI would funnel through that as well from a use case standpoint, yet it has its own sort of cross-governance carve-out to examine it on that basis as you look at the collective? Is that sort of what you're doing with the governance model?
Yeah, I will say though, we are, the Automation Center of Excellence does incorporate AI. To your point, buddy, that is how it funnels it. But we have we have other governance structures in place for, we have an EHR operations group that helps dictate, some use cases or different technologies for our applications. We also have an application advisory committee that helps prioritize some of those projects to really fine tune, like, when are we going to be able to start these? And I like to call it doing the horse trading. So we have executive sponsors who approve a project or, and sign off and say, yes, we need to do this. But there's competition between, those execs. And so the horse trading of those projects happens at that application advisory council level. And then data governance is actually looking at, the structures and what data and making sure that it's contained and safe. So that our governance is complex, but and actually Donna has kind of asked us to, now with AI emerging more, does our governance structures make sense? So we're iterating, we're continuing to evolve. And like I said, in this maturity model, we have not yet actually the communities of practice around AI. It's small. It has opportunity to continue to grow.
Oh, you good systems thinkers know how much those interdependencies will cause you to continue always to refine that governance model. Did one of you want to say something else?
I wanted to ask a question of both you and Laura, since you're both practicing, in the field with healthcare. When you're prioritizing your AI opportunities going through that group that you were just referencing, do you look at risk and ethics and other things in the use of those AI tools before they're prioritized? And does that committee do a thorough job of analyzing that type of information before you decide on which projects have a higher priority? Sounds like the MFM one is extremely important. I mean, just because of the risk to the newborn or the unborn child. But how would that actually take place? And how educated are people, or is that your responsibility to educate them on bias and efficacy and everything else that's part of that, so that they can make good informed decisions on behalf of their patients?
Laura, I'll let you go first.
Thanks, buddy. Great question, John. I think that there's a combination of education at all points, but the multidisciplinary committees that we really do have a great wide representation to help with those things like risk. So our ISO, our enterprise security office has a seat. We have legal, we have compliance, and that happens on the intake. And so really it does those risks, and we have to look at the big picture first. And is this going to deliver value before it gets prioritized? So I believe that it's really part of that groundwork that has to happen with any ideas or initiatives that are coming through. So that's how we're handling it, is trying to get the right people at the table evaluating these before prioritization.
Good.
So John, we're at the cusp of rolling out a formal AI governance structure. In fact, tomorrow evening, we have an AI town hall where we'll present AI policy and AI governance charter in a form that it's been developed and overread by 20-some people in terms of getting it right as best we can get it right, given how early this is. What you see here is probably two paths, similar to what Laura spoke of. The research side, of course, has the IRB and scientific review committees, and in essence, what I expect to see happen is just like you might consider a matter of drug efficacy as something that you now need to examine in a research protocol. If the AI box is checked, that's going to then trigger that research committee and or the RB to examine the AI uses on the causes of things that we've described. It gets real interesting on the research side, though, because sometimes you might be looking to see if there is bias and can you create bias while you're also looking at eliminating bias. Depends on what the matter at hand is. But on the clinical enterprise side, like you, and all the time that I know you practiced on the other side, the care that we give to anything that we introduce into the clinical milieu has to be of the utmost. Frankly, the business side has to be rock solid as well. And so the intentions there will be certainly to register all of the AI use cases, most often not coming from the development team, although we have a development team doing some things there, most often coming from vendors like Workday and several others that we're currently engaged with. And in those cases, similar to what Martin said, in addition to our own people having the discussion of context, we've already started a context discussion with Workday for the sake of bringing Workday's understandings of what it was intending with those kinds of changes to the table to give us those understandings for our assurance. And I expect, frankly, all of our businesses are going to have to figure out an efficient way to do this because it deserves all the due care we're talking about. I can't imagine every vendor trying to give care to every single client. Somewhere out there, I don't know that it will be regulated, or as you quickly pointed it out, but having us all move to some kind of harmonized way of doing things is always a wish on my part for all of the benefits that brings. Now, did we answer your question, John, before I ask?
Perfectly. No, perfectly. I like both the research and the clinician's perspective. So the clinical perspective is great. Thank you.
Okay, very good. Well, I'm going to do a time check. We're down to about 5 minutes. And I want to ask, do all three of your organizations have what you would consider to be solid AI policy at this point, formal policy?
I'll go first if you'd like. I think we do. I think it's something that we've been at this a long time. I mentioned early on 11 years in AI, but most recent generative AI, probably the last 3 years, 4 years working with that. But no, we have specific policies on how we do things and the appropriateness of the data. We have a lot of data. We learn off of about 60 billion transactions that we have at our disposal. However, we will always protect that data from a customer's perspective, no matter what, so that it doesn't get out into the wrong hands or it can't be used in any way to create unbiased situations. So that's really, really important. That's part of our policy and the way that we govern our data and how we utilize that data for our customers.
All right.
Sure. So John, whether you use the framework or not to put that policy together, all these elements are being reflected there, making sure that you're talking to the right actors, making sure that you're aware of all of your legal regulatory requirements. All of that is laid out in the framework, but as you probably either use it or you just inherently did it. One of the comments that I would make, Buddy, is in this discussion about bias, I think it's I want to make clear from a terminology perspective that we call it harmful mitigation of harmful biases, because there are biases in all kinds of systems that are totally fine. Bias towards safety, bias towards this, bias towards that, but we're concerned with harmful biases when we're thinking about harms to people and that kind of thing. So that would be the only comment that I would make, within this discussion. But this is great work, and I think Laura, the things you're talking about with the way that you've implemented policies as well, it's clear that you're talking to the right people and bringing the right people in a risk-based way, because every risk is not the same, every impact is not the same, and we're not just spending money on low impact use cases so that we can say that we have no risk. Those may be use cases that just really aren't, we don't have to do as much management.
Laura, final word.
Yeah, I think, last year, right away, the two CIOs, both from hospitals and clinics and the university side, partnered together to issue guidelines. And that was really helpful because as the new technology continued to emerge and unfold, people were using it willy-nilly, right? I mean, we had people on their phones using a chat GPT, when it might not have been sanctioned. So we wanted to at least get right out of the gates some guidelines and make them aware, of trustworthiness of the data. There could be hallucinations. So we helped define that for our caregivers and users to make sure that, they just bringing awareness. We do have policies now. And like I mentioned earlier, even at the state legislature level, right, we have new laws in place that, to help protect the citizens and our patients from any type of misuse. I will say, though, we are, always auditing to make sure we're staying safe. And that's a really important piece. So.
Hey, Sydney, I see you're back with us.
Yes, I never left. I've been here the entire time. So I see that we have a question in the chat. Kirk from Tegria is wondering if you can speak to legal's response to these challenges and risks, either internally or commercially. Are we seeing increases in risk limits?
Do any one of you feel comfortable answering that question given the context of our rules?
I think what I'll say is, we are good partners with legal and compliance, and every AI tool and source that we're looking at, we will have a BAA with and make sure we have like a general enterprise agreement with. So
Our
probably as much as
governance
I'll say.
structure calls out a seat at the table for the legal and compliance folks as well, as they give eye to the work that we do.
And the same occurs at Workday because we have a large legal team that's obviously engaged to a degree with this, and so they've done the reviews. They are very much engaged in this process, and so yeah, I'm not sure about increasing the risk limits or what's happened behind the scenes there. I'm not on the AI team, so I can't speak to that, but I'm assuming that they are being evaluated very closely from a risk management perspective.
Awesome. Thank you so much, you guys, for this super insightful session. We will see everyone at the next session with Joel Vanko from Hartford Healthcare and Barbara Casey from Pixel Health. Thank you again for your time. Take care,
Thanks.
you guys.
Bye-bye.
Bye-bye now.